Welcome to Module 2. We'll be discussing the market research. So, you've decided to open a DPC practice, but why? Let's figure it out together. So in this module, we'll be talking about target audience, what's missing, and assessing the competition. In the beginning, when you're ready to start your direct primary care practice, it's already in your heart. You want to do something different. You want to provide a different level of care. You've been hearing all the buzz. But in your area, what's your target? Who are you going for? We can't be everything to everybody. And that's one of the biggest mistakes. Remember, I said, I promised you as your fairy DPC godmother that I would help you avoid pitfalls. One of those pitfalls is trying to be everything to everyone. Let's hone in on who is your target audience. Is it that you want to take care of families? Is your goal when you dream at night and you see your practice and you're getting up and getting dressed for work? Are you going to take care of the mom, the dad, the uncle, the cousin? Is that your goal? Then you're looking to do family. Or is it you just want to take care of women? You've got this passion for women. You want to make sure women are their best selves. You want to address all the women's health concerns. Then that's your target audience. Or is it older adults? Do you have a passion for the elderly, the aging? In Florida, we have a huge aging population. Have you found a sweet spot for them? Is that what you did in your RN career or your previous nurse practitioner career or MD career? Then your target audience would be older adults. Or is it occupational? Do you want to be the provider for those big construction companies that have an on-site direct primary care or little clinic? Is that your goal? Then that's your target audience. I want you to start kind of thinking about who do you want to serve, because this will serve us later as we look at who's already serving that population, what does that population need, and then how do we get our information into that population's hands. So in the target or in the market research, we first need to think about who's your target audience. So take a moment, write that down. Who's your target audience? And then once we know who's our target, know what our job is to do? Fill in the blanks. What is that demographic? What are they missing? So let's say, for example, it's women. Women in your area, you find that they are having more babies than their heart desires, or they're struggling with fertility, or menopause is being missed. What do the women need? That's where you come in, and that's your niche. You fill in the gap. You become their hero. You want to be that woman's hero. So now they're flocking to you. You are saving the day. So we have to figure out who's our target, what does our target need? And then we assess the competition. Who's already doing what's in our heart? Now, do not get discouraged because someone down the street is already doing it, because have you not seen CVS in front of the Walgreens? Have you not seen Burger King across the street from McDonald's? So me being across the street from you means absolutely nothing, because I have something that this person needs and you have something that that person needs. So being in competition is actually a good thing. I love my competition around town. I love it. You know what it does? It draws light to the DPC movement. When someone else puts a billboard up and they go, whomever ABC DPC, the person goes home and looks up ABC DPC, you know who they find? Ultimate Health DPC right up under it. So I love that marketing. I do not get discouraged because someone else is my competition. We don't compete. We complement. We fill in the blanks. So if I'm adding a service, I say, okay, I know the gentleman across the street does this particular service, but he uses this brand and I use this brand. So like, for example, I do hormone replacement. I use a branded hormone replacement. He does not. We're both doing the same thing, but his patients love what he's getting. They like the price point. Mine love what they're getting. They like the brand. And so there's someone for everyone. I love him. He loves me. We wave at each other. It's great. So in our market research, who's our target? What's missing? Let's become that hero. And then let's not despise competition. Partner. I remember there was a new DPC came to our county, and one of the imaging reps told me, Amanda, 2 new ones are coming to town. I said, their names are? And I called him up on the phone. I called the office. Hey, may I speak to the doctor? One had a doctor, one had a nurse practitioner. They got on the phone. I welcomed them. And I said, hey, Come, go to chamber meetings with me. Come be my sister in this thing, because we're on this front line together. So please do not get discouraged because someone is doing the exact same thing or offering the same thing. You have something unique to offer, and there are a bunch of people that need to be served. So when you start doing your market research the competition, but only to fill in the gaps. I'll see you in the next module.